Hansen, and I work with as part of the Maternal-Child outreach team at the Tacoma-Pierce County Health Department. I, along with Britannia, we're a two-team program. So as I said, I'm from the Tacoma-Pierce County Health Department, and where our mission is healthy people in healthy communities. So what do we do and what do we provide? So we do, our services are really individualized to the client. We're able to help with enrolling clients into medical through Apple Health or one of the qualified health plans. We're certified navigators, so we have access to applications to be able to help on the Washington Health Plan Finder, which is a really huge part of what we do, and it's we're really lucky to have that access to be able to help. And then also, so when we get a referral, we're always wanting to find out what the insurance coverage is, what if they are already covered. We want to know what managed care plan they may have, so that we can let them know about things that might be covered by their managed care plan. But the other thing to keep in mind too is that even when we get referrals and the client has private insurance, we are also wanting to look and encouraging the client to apply for Apple Health as a secondary insurance. A lot of times they don't know that they would be eligible. We know income guidelines are a lot higher for pregnant ladies, so we're always wanting to help with that. And then we can help find a doctor. You know, we go off of maybe they have a hospital they want to deliver at, and so then we're able to say, here's a list of doctors that deliver at this hospital, or here's a list that deliver at the other hospital. And so we're really able to help with that connection. And then we want to make sure that all ladies are connected to WIC, or that they know of it. So maybe they haven't heard of it, so we'll explain it to them, and then we give them the contact information. The next thing that we can help link is with breastfeeding support. So whether we link them to the lactation support at the hospital, or the WIC clinic, or virtual lactation support, or through their MSS provider, that is one of the things that we can help get them linked to. The other thing we do is we, regardless of if the mom is a smoker or not, we provide information on the quit line. And of course, if she is a smoker, we might provide some additional information, or maybe there's someone in the house that's a smoker. So we want to provide that information to all of our clients. The next thing is we can help if they're interested in childbirth classes, getting them linked to the appropriate class, and especially letting them know if they have Apple insurance to make sure they register for a class that's covered by provider one. The other thing we do, and that we really emphasize, is safe sleep. All of our clients get that information. And so we spend quite a bit of time talking about that, and making sure that we have some visual handouts that we give them, and we encourage to not only go over the information, but to review it with any other family member that might be also helping care for the child, or maybe even a child care provider. In some cases, we are able to help them get linked to a crib if they meet the criteria to get a crib, or we may refer them to whatever, if they're already connected to an agency that has access, then we would encourage that route. The next thing that we do is we are always looking at what programs the client might be eligible for. So whether it be maternity support services, we link to, they have Apple Health coverage, we link them to the program that they may choose, or if they don't have a preference, we know that there's relationships that some of the MSS providers have with some of the hospitals or medical clinics, so then we will refer them to that program. so that they can get linked to maternity support services. And then, of course, the other thing that we do is also look for eligible clients that might be qualified for Nurse Family Partnership. We are linking them to that program, providing them with information and getting them connected. And we do much more. So again, it's very individualized on what the client, based on what they want. So we have a lot of different partners that we work with. So how do you connect or coordinate with other providers or clients? Once we receive the referral, we have a pretty quick turnaround time. We will then contact the client and follow up and let them know about the services that we offer. And then also we're coordinating with, once we know we're referring to, whether it be whatever program, a lot of times we're doing that soft handoff to make sure that the client gets connected. We're also following up with the client to make sure that they've heard from whatever services that we're referring to, because we want to make sure that that there's that connection. And we're able to text, so that's a nice feature, or call. So who should you refer? Well, all pregnant ladies. And of course, we prefer as early in pregnancy as possible. And so we know that we can have a bigger impact on birth outcomes the sooner we can get the client connected to services. Even though both China and I have specific geographic areas we cover, we do not turn anybody away. So we will link. And then the other thing I really want to stress is that we do not use any MSS units. We're not competing. We want to make sure they get connected. In fact, we don't even take a majority of the referrals that we get, unless it's an NFP eligible, which still that's a small number. We refer out to the MSS agencies. So we do not, we're not competing. We're wanting to make sure they get connected to your services. And so how do you refer? Well, there's a couple ways. You can go through online, and there is a link that's